Hi everyone. In today's clip, I will talk a little bit about spinal stenosis. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please ensure to consult your healthcare provider. So the back is a complex structure consisting of bones, muscles, and other tissues. The core of the back is the spinal column, which houses and protects the spinal cord. This is the delicate nervous system or highway that carries signals to and from the brain, which controls the body's movements and convey its sensations. Stacked on top of each other, there are more than 30 bones, the vertebrae, that form the spinal column or the spine. Each of these bones has a central hole or opening that when stacked with all the others, they create a channel that surrounds and protects the spinal cord. The spinal cord goes down from the base of the brain and is about 18 inches long for men and 17 inches long in women, which is much shorter than the length of the bony part of the spinal column. Small nerves enter and emerge from the spinal cord through the spaces between the vertebrae. The spaces between the vertebrae are maintained by round spongy pads of cartilage called intervertebral discs. These discs allow for flexibility in the lower back and act much like shock absorbers throughout the spinal column to cushion the bones as the body moves. Bands of tissue known as ligaments and tendons hold the vertebrae in place and attach the muscles to the spinal column. So spinal stenosis is a condition of abnormal narrowing of the spinal canal. This narrowing limits the amount of space available for the spinal cord and the nerves, and if only a small amount of spinal narrowing happens, we won't even feel any pain. But as it becomes narrower and tighter, it also becomes more severe. There's compression and squeezing of the spinal cord and its nerves. If narrowing continues, the nerves that travel through the spinal column to the legs become squeezed, leading to back and leg pain and leg weakness. So spinal stenosis can happen anywhere in the spinal column or spinal canal, but it's most common in the cervical and lumbar spine. The symptoms of spinal stenosis depend on where the stenosis happens and how severe it is. The most common symptoms is lower back pain when standing or walking, and leg pain and numbness can inhibit sort of walking, and the spine may lose the lumbar curve that appear and it's going to appear flat. When stenosis develops in the neck, there can be a compression of the spinal cord and the nerves that travel into the arms and hands. So this can cause symptoms of worsening balance, falling, dropping objects, difficulty even buttoning a shirt or picking up small coins or something, loss of control of the bowel and or bladder, numbness and tingling. When the stenosis develops in the lower back, there's compression of the nerves that travel into legs and feet. This can cause pain, numbness, tingling, weakness or cramping in the legs and feet, particularly progressing with walking and finding relief when the person rests or sits down. Now, arthritis, and especially osteoarthritis, can cause spinal stenosis. The wear and tear of arthritis can cause the body to grow extra bone in the spine or bone spur, which can grow into the spinal canal and press on the nerves. Also, the ligaments that hold the bones together can become stiff and thick over time because of arthritis and push into the spinal canal. Western medicine offers prescription medications such as antidepressants, anti-seizure drugs, opioids, epidural steroids, as well as physical therapy and exercise. and in some cases, maybe even surgical treatment. I've heard of few most recent treatments, one being stem cell therapy, where they extract stem cells from the bone marrow or adipose tissue, and they process and concentrate them in the lab and inject them into the affected area in the spine. This is minimally invasive and stimulates body's own repair mechanism and addresses the root cause of the issue. Then there's also, they offer a disc seal to repair damages to spinal disc using a sealant. So they do an MRI to identify the damaged disc, and they inject a compound into that area. Another method is acupotomy, which is a mixture of acupuncture and surgery. In this, they do imaging and find the problem area. Then they insert a specialized needle to the affected area to release the tight tissue. Certain vitamins and supplements help manage symptoms and slow the progression of spinal stenosis. Key vitamins in this includes vitamin D3 and K2 being super important, vitamin C, B12, along with magnesium complex that has glycinate, citrate, oxide, chloride, and threonate, and omega-3 fatty acids, and glucosamine chondroitin MSM complex, as well as curcumin and bromelain. Of course, castor oil, poke root, and comfrey packs are super helpful in healing. Metaphysically speaking, this ailment can relate to emotional stagnation, fear and anxiety, and sense of being overwhelmed or constricted, lacking support or feeling unsupported, resisting change, reluctance to adapt to a new situation or challenge, and or depression or low self-esteem. It's important to remember that everyone's experience with spinal stenosis is unique, as with any other ailment. What resonates with one person may not resonate with another, and it's essential to explore what feels meaningful and helpful for each individual. Hope this has been helpful. Like and follow for more. Be the light.